there are different types of reflux, and I want to start by just talking about the main types of reflux. One type is called GERD, gastroesophageal reflux disease. And this is typically associated with a type of reflux that is acidic. So there is non-acidic and acidic reflux. And so GERD is usually diagnosed with an endoscopy, and they usually see some sort of erosion in the lower esophageal junction, this junction that connects the esophagus to the stomach, or the esophagus, or some sort of inflammation, maybe esophagitis, maybe some gastritis, inflammation of the stomach lining. But usually there is some element of inflammation or erosion with gastroesophageal reflux disease. And typically the symptoms of that are heartburn, chest pain. There may be some difficulty breathing or throat burning, throat pain. You may have a sensation of something stuck in your throat. You could have pain right underneath the rib cage, in the upper abdominal region, or maybe pain in between the shoulder blades. So that pain in the upper abdomen and in between the shoulder blades is actually this lower esophageal junction area. And some people feel that in their front or their back. And so that is something important to note, because sometimes people are having that back pain and they don't necessarily know that it could be related to reflux. And a really common thing that I'll hear from my clients is that the pain feels almost like a pinching in between their shoulder blades. So those chest symptoms are often associated with GERD, but there are other symptoms like coughing, postnasal drip, or even regurgitation. Now, I mentioned there's another kind of reflux called non-acid reflux, and this is usually associated with laryngopharyngeal reflux, or LPR, also known as silent reflux or respiratory reflux. So LPR has many names, and it's usually associated with non-acid reflux, and it's usually due to a little enzyme called pepsin. And pepsin is in our stomach. It helps us digest our proteins, but when stomach contents consistently move into the esophagus, it brings pepsin with it. And when pepsin is in places it shouldn't be, it can actually burrow into the tissues of our esophagus and our throat. When pepsin is in the tissues of our esophagus and throat, it can be very inflammatory. It can be very painful, or it may result in certain symptoms that have nothing to do with heartburn. So people with LPR often have voice hoarseness, they may have postnasal drip, coughing, difficulty breathing, some feeling like something is stuck in your throat is a really common one, mucus production. I feel like I'm forgetting one, but really these symptoms are more concentrated in the throat and respiratory symptoms. That's why it's often called respiratory reflux. So that pepsin that lives in our esophagus and our throat, every time we eat something acidic, the pepsin can be activated. So things like vinegars, citrus fruits, alcohol, diet soda or soda, any kind of acidic beverage. This can activate pepsin, and it can trigger those symptoms of the mucus production, coughing, postnasal drip, or even voice changes. Now, current research does not support the permanence of pepsin in our tissues. So it doesn't mean that this is a permanent thing, but it might mean that we do need to go through a temporary period of elimination of those acidic foods and the reflux triggers so that we can take a break from activating pepsin and reduce inflammation. So really important to know that there are different types of symptoms, and you do want to look out for those. And it's also important to note that reflux symptoms can change over time. One of the most common things we see with our clients is that reflux symptoms may start a certain way, like maybe it started with a bitter taste in your mouth, or teeth sensitivity, or heartburn, and then maybe later as you continue on, the symptoms might shift. And this could be due to changing certain things about your diet, about your lifestyle, or certain medications. If you take a proton pump inhibitor, you might not feel the burning anymore, but you may still get regurgitation, or you may still get that bitter taste in your mouth. One other thing to note about these two types of reflux is that current research is showing that PPIs, or proton pump inhibitors, are not as effective for non-acid reflux. So it's really important to kind of take a look at your symptoms, work with a healthcare provider that you trust and that is educated about reflux so that you can understand your unique condition and how to treat it.